Thierry is working in my unit and is the coordinator of applications for authorization. He's got insights of this process from day one. We started to develop the process. And he'll be talking about how to apply for authorization, all the elements. So the floor is yours.
Okay, thank you, Matti, and good afternoon, everyone. I will give this presentation to present you a quite general overview of the key elements that are necessary for an application for authorization. I will start with the starting point, and I will also go through the application strategy, the description of the use applied for, and I will also quickly explain what the three assessment reports are composed of: the chemical safety report, the analysis of alternatives, and the socio-economic analysis. Starting point. So the application for authorization can go into two routes. The first one is called the adequate control route, and this relates to threshold substances. Under this route, the applicants must show that the risk from using the substance is adequately controlled, which means that the exposure are below the DNL or below the PNEC. The second route under which an application can be processed is the so-called socio-economic route. This route concerns only non-threshold substances and threshold substances for which adequate control has not been demonstrated. Under this route, the applications must show that the socio-economic benefits of using the substance outweigh the risks. And there's a second condition, that there are no suitable alternative substances or technologies. I will further explain what suitable alternative means. In terms of assessment reports to provide in the dossier, you have basically three situations. The first one on the left-hand side is where adequate control is not demonstrated and there are no suitable alternative. So this is the CR route. Under this option, you have to provide the chemical safety report, the analysis of alternatives, and the socio-economic analysis. Second case would be where adequate control is demonstrated and there are no suitable alternatives. In this case, again, you have to provide the chemical safety report, the analysis of alternatives, and we highly recommend that you also provide a socio-economic analysis, because RAC may disagree with your conclusions on adequate control. And if RAC disagrees with your conclusions, then the dossier drifts into the CR route. That's why we highly recommend that you provide also a socio-economic analysis. And the third scenario is where adequate control is demonstrated and there are suitable alternatives. Suitable alternatives means that they are economically feasible, technically feasible, and they are safer. So they must meet these three conditions. Under this last option, you provide the chemical safety report, the analysis of alternatives, a substitution plan, and we also recommend that you provide a socio-economic analysis because again, RAC may not agree with your conclusions on adequate control. In terms of support, ECHA offers quite a lot of documents, guidance, questions and answers. We have a list of 80 or 85 questions and answers available on our website. We have user manuals. We also have published quite recently the so-called How to Apply for an Authorization Guide. I strongly recommend that you have a look at this guide. We also have quite a bunch of documents, papers, which relates to the evaluation of your dossier by RAC and SEAC. I recommend also that you read the length of the review period paper, the economic feasibility paper, and we also publish RAC's reference dose response relationships. There is also a platform, so-called partner service for applicants. This is where people register themselves and you can find there many stakeholders involved and interested into the submission of an application. We also offer pre-submission information sessions. Again, I strongly recommend that you book one of these PSIS before you submit your application. These are generally considered very useful. So basically, you provide a draft dossier, and we review and discuss the draft dossiers and the key elements with you before you submit. There is also some information available for small and medium-sized companies. And finally, we have many materials published related to seminars, webinars, workshops held by ECHA or by other organizations, industry associations, for instance. So this is on our website. Now, the application strategy. So this strategy is influenced by some factors. The first one is the supply chain mechanism. So you have to realize that REACH has been initially set up in such a way that it's more a top-down approach than a bottom-up approach. If you read the, if you look at the left-hand side pyramid, you can see that if the applicant is a manufacturer, an importer, or an only representative, he can cover basically all the uses down his supply chain. So this is the first option under which an application can be prepared. In the middle of the slide, you have the case where the application is made by a user, in that case a formulator, for instance, and he will cover his use and the downstream uses. In this case, the actors on the top of the pyramid can still place on the market for the downstream users the substance, provided that they have no use themselves, of course. And the third one is the case where the application is made by a downstream user, okay, at the, let's say, not the bottom, but intermediate stage. And of course, these downstream users can cover their own use and they can cover downstream uses, but they cannot cover uses upstream. So this may influence quite a lot the way you want to prepare your application. Something which is not there is the case of two-level AFAS. For instance, manufacturers could apply for the formulating use, and the formulators could apply for the downstream uses. This is also something that we have envisaged as an option for submitting an application. Then what can also influence your strategy is the scale of what you want to cover. We have observed more or less three types of AFAS. The ones submitted by a single downstream user. Normally they have one or two uses, and the scope is rather specific, very detailed. They have all the data in their hands, and there is no, let's say, uncertainties. The exposures are quite clearly documented. The substitution story is there, so they have the data. Then the second type is the so-called multiple downstream users. So here it's a group of, let's say, 5, 6, 7, sometimes 10 DUs using the substance in a similar way. And they apply for 5, 6, 7 sites in there. And here it started to be a bit more, let's say, complex than a single downstream application. And the representativeness of the operational conditions, risk management measures, and the exposure data starts to come into play. But this is already quite straightforward. And then the last type of application is the one made by upstream actors. So most of the time they cover multiple downstream users from 20 to several hundreds, sometimes several thousands, I would say. And you don't have specific data per site, of course. So we call them large upstream applications, and sometimes applicants take the representative standards approach to describe the OCs and RMMs. And this is at the moment the most complicated applications to deal with. The third element for the strategy is the scope and the number of uses that you want to put into your application. Normally this scope definition is an iterative process. You have to take into account many factors, and it's unlikely that you will derive it in one go like this. Basically, we have two types of uses. We have uses with what we call a narrow scope. The exposure scenarios are straightforward, well documented. We know how the workplace is working. Also in terms of the assessment of the alternatives, this is quite straightforward and well explained. And there are most of the time clear justification that the benefits outweigh the risks. These type of applications are likely to be granted the requested review period. And yeah, these are the pros for having such a narrow scope. The con is that the application may cost a bit more because you would need, for instance, to have 2 or 3 different uses instead of one use, and you will be charged in the fee for additional uses. So this may cost a bit more, but we think that this is sometimes worth it to have more narrow scope uses than one big broad scope use. And on the right-hand side of the slide, you have the pros and cons of a broad scope. Pro is that the application cost may be lower because you will put everything in the same basket. However, we have observed that these type of uses are much more complex and contains much more uncertainties on the exposure side, on the analysis of alternative side, also on the socio-economic. And the justification for authorization or review period could be affected by these uncertainties, potentially leading to short or shorter review period than requested, or even a refused authorization. So you have to be very careful when you define the scope of your use. Now we're going more in detail into the use applied for itself. So as I said, the use applied for is a critical step of your dossier preparation. The uses define the scope of your application, and they are the core and the basis of any authorization granted. The uses must be defined clearly, described in details to get rid of these uncertainties that may affect how your application will be evaluated by RAC and CERC. So please give the context of your use within your process, your business, the market you are commercializing the substance or the products. As I said, the uncertainties in relation to the scope may lead to shortening of the review period for the whole use if you have put everything in the same basket, or potentially to not granting an authorization. Okay, what are the elements of the use description? We have identified 3 of them. The first one is the name. So the name of the use applied for is kind of the tip of the iceberg. It's the title of your book, if you want. So it should ideally include the function of the substance, the end products that are associated with the use of the substance, and the market sectors that are or where these end products are commercialized. So if you get the use name right, it's already good. Then the second element of the use description is the exposure scenario. So that is from the exposure side of the equation. The exposure scenario should describe operational conditions and risk management measures, the underlying processes, and the specific tasks leading to exposure of workers, consumers, and the environment. So basically, you explain how the people handle the substance. And the third element of the use description is in relation to the analysis of alternatives. So this is also a critical point. The analysis of alternative or the use description should include a clear set of technical criteria, specifications, functional requirements for the substance and for the end products. We strongly recommend that you don't apply for uses, or you don't put into the use descriptions sub-uses where there are suitable alternatives. If you would include such sub-uses where substitution is possible already before the sunset date, for instance, then we recommend that you clearly state them and that you do not include them in the scope of the use. Okay, so now the assessment reports. First one is the chemical safety report. we call it the CSR, it describes the use, exposure scenarios of the substance and the risks to human health and or the environment arising from the intrinsic properties for which the substance has been placed into the authorization list. Important to notice is that the CSR only needs to address the risks posed by the hazard properties of the substance that are listed in Annex 14. Some other properties may be relevant for the AOA. This is where you would try to compare, for instance, risks across different endpoints between the alternative substance and the Annex 14 substance. What is new compared to registration, for instance, is that in the alpha, instead of submitting a complete CSR, ECHA recommends that where RAC has derived DNL or dose response relationships, you only fill in section 9 and section 10, which means the exposure scenarios and the risk characterization. You don't need to fill in all the hazard assessment information because this has been done by RAC already. Exposure scenario. So I don't know if everyone knows, but an exposure scenario is the set of OCs and RMMs that together describe the use and the measures taken to control exposures of humans and the environment. Normally, the exposure scenario is structured in such a way that it is subdivided into environmental workers and consumer contributing scenarios. It's likely that for workers, you would need several contributing scenarios that can be used to distinguish between the exposure potential of different tasks. For instance, sampling, material transfer, loading, unloading of substance or end products. And to distinguish between different groups of workers. You can have workers that are involved only in the process areas, and some of workers can only do maintenance, so you have to clearly distinguish between these types of workers. And the CSR also contains the risk characterization. So the risk characterization is the calculation of RCRs, or excess risks, that should be undertaken for all relevant endpoints, tasks, routes of exposure, and populations, including article, service lives, and consumer uses of mixtures, if relevant. By route of exposures, I also include exposure to humans via the environment. This is also an important element that you should not forget. Where applicable, this risk characterization for workers should be undertaken based on aggregated and shift-long exposures across different tasks. That's an important point. And incorporate all relevant routes of exposure, for instance, inhalation, thermal, manner in the environment again. Under the adequate control route, we also recommend that when the RCR value approaches 1, you conduct a sensitivity analysis. This may be wise. Okay, the analysis of alternatives. So in the AUA, the applicants have to identify the alternative substance or technologies, and he has to analyze at least 4 parameters. The first one is the technical feasibility. Technical feasibility should be judged based on whether or not the alternative fulfills or replaces the function of the Annex 14 substance. Then the second parameter is the economic feasibility. These are the changes in the costs and revenues of those actors currently using the substance if they would adopt and implement an alternative. The availability, also you have to explain a bit whether the alternative could be regarded as available, whether it's accessible before the sunset date and available in the required quantity to allow full implementation. And you also have to assess in the AOA the risk reduction potential of the alternatives. So suitable alternatives must result also in a reduced overall risk to human health and the environment compared with the use of the Annex 14 substance. So these are the 4 criteria that you have to assess in the AOA. In the AOA, you also have to outline your substitution planning activities. So what have you done in the past? What are you currently doing? And what you will do in the future related to the identification of possible alternatives. You have to also explain what is the estimated time that would be required for testing these alternative candidates, and the time needed for any relevant certification, qualification, or any kind of regulatory approval. When describing the R&D capacities, you have to take into account also the time optimization, for instance, whether parallel activities or testing are possible or not. All this information is taken into account by CERC in setting the length of the review period, so this is quite important. Last bullet point is, if for an adequate control route situation, you would need to provide a substitution plan if there are suitable alternatives. So it means that the alternatives are technically, economically feasible, they are safer, and basically you need a few years to implement this alternative full scale. And the last element of your dossier will be the socio-economic analysis. So the CR describes, in a sense, what would happen if the applicants or other actors in the supply chain were no longer able to use the substance. This is what we call the non-use scenario. And what would be the impacts to the applicants and or other affected actors. The aim of the CR is to conclude whether the socio-economic benefits outweigh the risks. So this is the, let's say, the aim of this assessment. The socio-economic benefits are considered in a broad sense to include impacts on applicants, but also on suppliers, consumers, competitors, market functioning, etc. So the scope is a bit broader than what could be the scope of the AOA. The applicants should not only consider the impact on them, but explain the anticipated reaction of the market to changes in the product or the service that are provided in terms of quality, performance, price, availability, and value added to the society. And, oops, and this would be the last slide. So there are clear links between the CSR, the AOA, and the CR. This is summarized in this slide. Basically, the CSR helps you to monetize the risk, and the AOA can help you to build on the non-use scenario or to put cost of substitution, for instance, and all these are put into the CR, and then the CR conclude on the overall benefits and risks comparisons. So having said that, this was my last slide. Thank you.